Good morning, everyone. Good morning, Dr. Rotter.
Good morning. Good morning, everyone.
What an exciting topic. And it's kind of, I know people who watch us, they kind of hear that often, but it's just so important to answer the question, can small employers offer healthcare?
Yeah. And typically the answer is no, because it's just too affordable. The bigger the company, the lower that the premiums will be offered by the big healthcare insurance companies. But so we've already talked before about the difference between health insurance and access to healthcare. But actually, what prompted me to want to talk about this today is that I was looking back at some of our numbers and what we do, and I've found that we are in the process right now of offering. We have made it. We have created a way for hundreds. This is a real-time number, hundreds of people to have affordable access to healthcare through dozens of employers, small employers. And I say small, meaning less employers that have less than 50 people. So this is really significant to me because this is the model or the recipe for access to affordable care. So many people have, well, there's so many small business owners. That's part of what makes America great.
Right.
It's that we can own a business if we want to, and just think about how many small business owners there are, and it's typically they think that to provide a healthcare benefit, it's got to be insurance. Well, not necessarily, because insurance is not access to a doctor. So it's a good feeling for me to know that we are in a model that is actually doing this. I mean, with hundreds of people, we've proved it now over time. And then knowing that reminds me of how back in 2004, when I helped start a company called Teladoc, it was the same model, a similar model. It didn't have to do with insurance, but back there in the day when Teladoc was just starting, it was a membership model, and it was offered to employers.
Mm-hmm.
Okay? And those employers gave access to doctors through telemedicine. This was back years ago. So it's a good feeling to know what we're doing.
Yeah, so it's really that concept of the people coming together and just gathering around a cause that they care about, which is something as simple and essential as access to healthcare, having that direct relationship with you, the physician. And I appreciate that a lot too, because I'm a small employer as well. And we have the membership with DirectMed Clinic for all of our employees and to some extent also their families. And I'm so grateful, and they are so grateful. I'm so grateful that I have a simple way of offering them something. I actually decided to cover the membership fee for them, and it just makes me look the way I really am, which is a caring employer that wants his team to have access to you and your staff. And it's just so beautiful. It is also very unbureaucratic. It's very easy. I have a portal where each month I can go in and I can update the team members that I want to enroll or unenroll. It's very easy, and I just highly recommend that to anyone who cares about their workforce. And who doesn't do that nowadays? because it's truly, if we as business owners have to understand that we're only as strong as our team is, and we want the team happy, healthy, and also I can tell my business fellow business owners that it's a great tool for retention and also for recruiting, because not everybody can offer that.
I would argue that what you're offering is, in a way, more valuable than a large employer that offers a a, a Blue Cross card to their employees, because those type of healthcare benefits is insurance, and everybody knows that insurance premiums can be really high and deductibles are really high. So even
Mhm.
somebody that works for a large company and they have a health insurance card, they don't have what you are offering your employees. When a small employer buys these memberships for his employees, they can visit us in the office an unlimited amount of times without having to pay anything for the visit. Okay. And they
Yeah.
have unlimited access to us with virtual care as well. So that's why I think it's something that's usable, really usable and practical. And we can cover so much more. We can do what we do in the office is primary care and urgent care in the office.
Yeah, and I know that there's certain requirements that certain employers have depending on their size, and all of that you can address with your doctor liaison, doctor program liaison, and
Mhm.
that is also very helpful. So you have a link here, a ticker, link.directmedclinic.com/employers, and employers throughout the nation, they can go there at any time whenever you watch this video, whether it's now live or later as a recording. Go to that page and register for one of the many upcoming webinars where you, Dr. Roger, you explain more in detail of what you do for employers. It's very powerful, and it warrants its own session.
I feel really blessed to be in this space right now. I was blessed to be an innovator. The first doc doing actually teledoc consults was me back in 2004 and 2005, even before telemedicine was really a thing.
Yeah.
So I love innovation. I like finding better ways to deliver care. Um, and so I feel that that's where direct primary care is right now, today, where telemedicine was with Teladoc in 2005, 2006, and those early days.
Yeah, and I know that you are always open to innovation, and what is happening these days with what can be done remotely in telemedicine is really exciting. And I believe strongly that with Moore's Law in 5 years or so, we even further along than we could have ever imagined. And I know that you constantly keep yourself educated and keep your eyes on that technology to roll it out to your patients. So
Mhm.
I would just highly recommend anyone to give your membership a try.
Well,
Truly do.
like the title says, can a small employer, offer healthcare? Yes,
Yeah.
can, through direct primary care.
Whoops. Well, there we had our dear doctor disappear. Oh, it's coming back.
Okay, we're back. Rose or something. Um, yeah, so I was just saying that as the title says, ask the question, can a small employer offer health care? Yes, they can. It's through the direct primary care model. It's affordable access to care, and employees will love their employer for it.
Great. I love it. Well, I would suggest, as always, if you have questions, you can type them in the comments. We'll come back to them even after the live is over. And of course, go to link.directmedclinic.com/employers and register. It'll take 20 minutes to go through a webinar that will teach you so much about what you can do as an employer for your staff. Uh, any final ideas before we release our viewers today?
Oh, I'm always available to answer questions for employers about how it might look for them, whether it's a small employer or large employer. Um, there's a learning curve, and we can customize an approach to whatever makes sense for that employer, large or small.
Wow, amazing. So take Dr. Roger up on that offer. I mean, when have you ever had that chance that a physician tells you that? I just love it. And I know people constantly reach out to you and you guide them well. So, yeah, great talking to you today, Dr. Roger, and we'll be back later this week, I believe. Until then, everyone have a safe rest of their Tuesday, and we'll see you again here on this channel.
All right, to see you.
Bye.